USM1. A 5-year-old child with a history of poor diet presents with muscle weakness, ataxia, and difficulty with balance. Neurologic examination reveals loss of proprioception and vibration sense in the lower limbs. Laboratory tests show hemolytic anemia and elevated serum creatine kinase. A nerve conduction study shows demyelination of the posterior columns. Which of the following is the most likely diagnosis, and what is the treatment? A. Friedreich ataxia, coenzyme Q10 supplementation. B. Vitamin E deficiency, vitamin E supplementation. C. Vitamin B12 deficiency, vitamin B12 supplementation. D. Vitamin D deficiency, vitamin D supplementation. E. Spinal muscular atrophy, genetic therapy. B. Vitamin E deficiency, vitamin E supplementation. Explanation: this child's symptoms of muscle weakness, ataxia, demyelination, proprioception loss, and hemolytic anemia suggest a vitamin E deficiency, which leads to neurological and hematologic manifestations. Vitamin E is an antioxidant that protects RBCs and neuronal membranes from oxidative damage. Deficiency can mimic Friedreich ataxia, but without megaloblastic anemia or serum methylmalonic acid elevation. The treatment for vitamin E deficiency is vitamin E supplementation. USMLE Question 2. A 70-year-old male with a history of chronic warfarin therapy presents with bruising, bleeding gums, and easy bruising. He has been on high-dose vitamin E supplementation for joint pain. Laboratory tests show prolonged PT and INR. Which of the following is the most likely cause of his symptoms? A. Vitamin K deficiency. B. Vitamin E excess. C. Vitamin C deficiency. D. Vitamin D excess. E. Iron overload. B. Vitamin E excess. Explanation: the patient's high-dose vitamin E supplementation has resulted in excessive vitamin E levels, which can interfere with vitamin K-dependent clotting factors, factors 2, 7, AIX, X, and protein C and S. This can enhance the anticoagulant effects of warfarin, leading to prolonged PT and INR and an increased risk of bleeding. The appropriate action is to discontinue or reduce the vitamin E supplementation. USMLE Question 3. A 26-year-old patient presents with muscle weakness, difficulty walking, and coordination problems. Neurological examination reveals ataxia, proprioception loss, and diminished vibration sense. Blood tests show hemolytic anemia. The patient also has worsened coordination and muscle weakness after a few months of treatment for vitamin E deficiency. Which of the following is the most appropriate next step in treatment? A. Increase vitamin E supplementation. B. Initiate vitamin B12 supplementation. C. Switch to vitamin D supplementation. D. Administer iron supplements. E. Administer corticosteroids. Answer A. Increase vitamin E supplementation. Explanation: the patient's symptoms are consistent with vitamin E deficiency, which can lead to muscle weakness, ataxia, proprioception loss, and hemolytic anemia. If the patient is already on vitamin E supplementation, but the symptoms are worsening, the most appropriate next step is to increase the dose of vitamin E to ensure adequate levels, as vitamin E is essential for protecting neuronal membranes and RBCs from oxidative damage.